Well, good afternoon, Savannah, and welcome to the Water Cooler, an interactive conversation about issues and events pertaining to Savannah, Georgia. We encourage the viewers to join us. I know we've got Facebook with this morning and YouTube. I'm Marjorie Young. I'm going to be hosting it along with Nichelle Hodgkins. And today's topic is COVID-19. And just because the UN World Health Organization, WHO, has recently declared an end to COVID-19 as a public health emergency, doesn't mean it's over. And here to answer these questions is Dr. REDDICK. He's the health director for the Coastal Health District of the Georgia Department of Public Health, and co-hosting, like I said, with me today is Nichelle Hodgkins, communication manager for Healthy Savannah and the COVID Flu Reach. So Dr. REDDICK, what does this shift mean to the public?
So as far as to the public, there's not really a whole lot of change that'll happen, which is kind of hard for a lot of people to understand because they're like, oh, the emergency's over. And like you said, oh, that means COVID is over, right? No, COVID is still there. And so for the public, in my opinion, what it means is that the same things that we did to get us to this point with the COVID pandemic are the same things that we should continue to do. So things that we've done are things like just changing the way we look at infectious diseases and being around people. So if you're sick right now, you should still stay home from work, not go around other people. So if you have COVID, for example, you should be isolated away from people for 5 days is the minimum. If you have to be around people and there's no other way you can avoid it, then wearing a mask when you're around them. Making sure that you wash your hands after you use the bathroom or when you sneezing into your elbows. Those kind of things we should continue to do. And also and vaccination as well. Our vaccination efforts have contributed a lot to the decrease in COVID as well. So those things for the kind of the typical layperson are going to stay the same. As far as the things that are different are the way that we test for COVID, the way we vaccinate for COVID is a little bit different in terms of funding as far as places you can go. So some insurance companies may not offer what we've had during the emergency, which is free therapeutics if you have COVID infection or free vaccines or free testing. Those things might not be available to your private insurances or your private clinics, but they are fortunately still available through the Department of Public Health.
So currently, how many people have died of COVID since the pandemic started?
So in
Georgia.
Yeah, and I'm sorry, I'm drawing a blank on the exact number in Georgia. But in the United States, it's been over 1 million people in the United States. And so in Georgia, hasn't been, necessarily at the top, hasn't been at the bottom either as well.
Okay.
We fortunately haven't been hit as hard as some areas like New York or some areas in California were hit, or like how Portland and Oregon area was hit during the early pandemic. So we've been a little bit fortunate, but even there's a lot of variation from city to city. Atlanta got hit a lot harder than Savannah, for example. So,
yeah, somewhere I read that 25 cases are still showing up in Savannah a week. Well, I know it's definitely around. My aunt just got it. So,
sure. And that's the problem. And the thing is that's a little bit kind of tricky is that for people that either if you've been recently infected, then it is more difficult for you to get reinfected in a short period of time in those first few months. So if you take out those people and take out the people who are vaccinated, the majority of people that are getting hospitalized or dying from COVID are typically people who are unvaccinated. And so it's kind of a tough thing because we're saying, oh, there's the end of the emergency. A lot of people who are vaccinated that I know personally are saying, well, I feel comfortable going about without a mask, for example. But as far as people actually dying or getting sick or hospitalized from COVID that are vaccinated, in other words, a breakthrough infection where somebody's fully vaccinated and they still get hospitalized or die from COVID, that's only about 3% of deaths and hospitalizations. So 97% of those deaths, hospitalizations are happening in people who are unvaccinated. So it's kind of a bizarre thing because we're saying emergency is over and hey, a lot of people are just like, I'm getting back to normal, but we're still seeing a lot of people still, relatively speaking, a lot of people still dying and getting hospitalized with COVID. It's not as bad as it was during the peak of that Omicron surge. We've had about an 80 to 90% decrease since then. But the problem is the people that are still getting sick, the majority of them are unvaccinated.
Okay.
Well, Dr. REDDICK, I was wondering if you could give people some advice on, how do they know they should get vaccinated or how do they know they should get a second vaccine?
Sure. So the good news is that we've had kind of a range of different kinds of vaccines available, right? There was that Johnson & Johnson one, and there's the Moderna, and there's the Pfizer, and then there's the Novavax that came out. And so there's a lot of confusion about, well, which one should I get? Which one's better? The Johnson & Johnson people loved it because it was just one shot. The other ones, it was a series of vaccines, and then you had to get a booster, and there was so much confusion about it. The good news is that it's been simplified. So to answer your question, if you are 6 months old and older, then unless you have what we call a contraindication, in other words, a medical reason that the vaccine is not safe for you, pretty much everybody 6 months and up should get the vaccine. It's been studied. There's a lot of safety data. It's been approved and recommended for anybody 6 months old and up. Now, as far as which type, it may be difficult to know if you're just looking at your own card, how it was written. But if you've gotten at least one dose of the bivalent booster and you're 6 years and older, you're good to go. There's a few exceptions I'll talk about just now, but there's a few exceptions. But in general, if you're 6 years up to age 65 and you've gotten one of those bivalent boosters, you're probably good to go. That's the only vaccine you need. Now, the exceptions are...
Ooh, go ahead. Sorry.
No, I was going to say the exceptions are for people over age 65. They do recommend a second bivalent booster vaccine about 4 months after the initial shot. And also, if you have a moderate or severely immune compromised state, then they do recommend that you get a second shot 2 months after the first one. Okay. So moderately or severely immune compromised are people with significant medical problems like AIDS, for example, people who have HIV infection that have a very low CD4 count. People who have transplants, people who are undergoing active chemotherapy. Those are kind of your more severely immune compromised people. I'm sorry, go ahead.
What about pregnant women?
So pregnancy is kind of what they call kind of a more mild, severe, a mild immune compromised state. So there's kind of mild, moderate, severe. So pregnancy kind of falls in that mild. So just the traditional vaccination of just one dose is there. Now, there's a lot of people, unfortunately, the sad part is that a lot of people, really are fearful about what they put in their bodies while they're pregnant. So a lot of people defer the vaccine and say, I'll get it after I'm not pregnant anymore, or I don't want to get the vaccine because I might become pregnant. Unfortunately, the thing we've seen is that women that are pregnant that catch COVID have some of the more severe infections that we've seen.
Oh my gosh.
So getting COVID while you're pregnant is way, way, way more dangerous than getting vaccinated while you're pregnant. A lot of people ask me, like, can you put into numbers for me the risk of getting vaccinated? And what I tell people is that it's very similar to eating peanuts. Right, overwhelming majority of people eat peanuts and do fine. I eat nuts probably several times a week, just part of just heart healthy diet. But a few people die from eating peanuts. They have severe reactions or allergic reactions to peanuts, and it happens sometimes. Occasionally, you have somebody who will choke and aspirate on the peanut. It's just not common. It will happen sometimes. It's so rare that we don't ban peanuts. We don't say, "Oh, don't you dare go eat peanuts," because I heard a few people died from that. And again, peanuts, the reactions people have to peanuts are actually way more severe than when people have vaccines. We don't have people just dying from vaccines, but people can have severe allergic reactions, and some people can even be hospitalized if they have a severe reaction from it. But that's no different from the other things that we have in society.
So, Dr. Reddick, do you think that people are now more open to getting the vaccine? What is your take on that?
That is an excellent question. So I think in general, people are. We learn a lot more about vaccinations. I do think it's generational. So the so-called baby boomer generation, they grew up during a time where there was polio and measles was killing, tens of thousands of kids a year. And so they saw, like my dad talked to me about that, how he remembers people having polio and kids ended up, using wheelchairs because it became paralyzed with polio. And then the vaccine came out and all of a sudden nobody had polio. So that he saw that and that generation saw that. And so they believe in vaccines. If you look in Georgia at our vaccination rates for people over age 60, 90% of them are vaccinated. Like that generation believes in vaccines. They kind of heard about it. There was a little, kind of mistrust early off where they were like, well, I don't know about this vaccine. It sounded like it got rushed. It came up kind of fast. Let me learn about it. People learned about it. There was a lot of messaging about it from people like Healthy Savannah. A lot of people out there getting the messages out there. I remember Michelle and Paul and all of us were out there during Juneteenth educating people about vaccines and giving them last year. So I think that message got out there. There are still a subset of the population who just do not believe in vaccinations and they don't think they're safe. And there's probably nothing we can do to ever change their mind about it.
Well, one of the things that people tell me when I ask them about the vaccine is, I remember or I've read about Tuskegee and the Tuskegee experiment. So what do you say when someone mentions that to you?
Sure. So there's a lot of infamous studies, and the United States does have a history of mistreating some of their historically marginalized populations for sure. And so, but the difference is with those is that those were interventions that were targeted towards a specific subset. There was not a single white person in the Tuskegee syphilis study. It was, they targeted only Black communities. When COVID vaccinations came out, we had everybody from every walk of life lining up to get the vaccine. There were people in some kind of suburban, rich, upper class, predominantly white communities that were, when they were giving out the numbers, when they were kind of like, you know, targeting high risk populations on the West Coast, there were people who were stealing the numbers and kind of stealing codes to get their vaccines early from non-Black communities. Like, that's how you know the difference. If there's ever a moment where they say this vaccine's for only Black people, then okay, maybe I'll listen to some of the conspiracy theories, right? But this is something that was across the board, and it wasn't targeted towards a specific community.
Sure. And it was the withholding of treatment as well. It wasn't that they were given a syphilis; it was withholding care, essentially.
Absolutely. In that situation, we had penicillin had been discovered, and they were going out of their way to make sure that people in rural Tuskegee, Alabama, did not get the medical treatment that was there. So this is what people talk about is the opposite of what happened in those kind of studies.
Nichelle, are you finding with your REACH grant in the COVID flu area that people are now more receptive? And also reiterate what the REACH grant is.
Sure.
The
REACH grant is a grant from the CDC, and it stands for Racial and Ethnic Approaches to Community Health. And we have four strategies that are funded under that, including physical activity, nutrition, community clinical linkages, and then a few years ago, COVID and flu. And part of what is funded through that grant is the community health advocates program. And through them, we've learned a lot about what's going on, you know, on the ground. And they have been working out there to get solid information out to parts of the community that I would never be able to reach. And what we're finding is that a mix of things, that people are not wearing masks, and that's something we can all observe. That people have just said, look, I already had my initial series, I'm good. But Dr. Reddick, that is probably the farthest thing from the truth, right?
Yeah. And so, and again, there's a lot of fatigue, like you said, around it. And a lot of times people, they'll say, gosh, what's the use of me going out, especially for somebody who's vaccinated? They're like, well, gosh, if I'm in a building of 100 people and I'm the only one wearing a mask and I'm vaccinated, the risk is probably pretty low to me. The reason I will wear this is to protect other people, but other people don't have the mask on. So why bother? But the one thing you can control are the measures about yourself. So like things like we talked about, hand washing, and just when you're sick, not just trying to rush back to work, or like, oh, I don't want to use my time off, so I'm just going to take a Tylenol while I got a fever and like sneak back to work. Or I've gotten those first 2 vaccines. They talk about this new bivalent booster, so I don't feel like doing that. I think I'm good. Like we're seeing the trajectory go down as far as the hospitalizations, the deaths. And I think that's the wrong time to let your foot off the gas. If you are like, let's say you were, for whatever reason you didn't get your bivalent booster, like go ahead and get it right now. They're really simplified the regimen now. Again, if you're 6 years and older, unless you're over 65 or unless you're immune compromised, you got 1 shot of that bivalent booster and you're good to go. So that's the kind of thing we're still encouraging. We've really seen the numbers plateau off, unfortunately, but we do still have people that come in and get sometimes their very first COVID shot still.
Well, at least they're getting it. So where can people get the vaccine now in Savannah? And is there a cost?
Yeah. So for people that are seeing their private physicians, there might be a cost associated now. Under the public health emergency declaration, the vaccines were covered for free. But now that emergency is over, then there might be a charge with people's insurance. But the good news again is that you can come to the health department where we don't have a charge. If somebody does have insurance, we do attempt to get reimbursement. If somebody's insurance doesn't reimburse us, then we're not here to try to make a profit. We will provide those vaccines for free. And also same thing with COVID testing as well. COVID testing is available for free, not only at our health department sites, but also at the kiosk that we have a couple kiosks throughout the city.
Where would those kiosks be, and how would people get in touch with you or
Sure.
the department?
Sure. So our main health department is located at 1395 Eisenhower Drive. A lot of people know where the big DPH building is on Eisenhower, right near Lake Mare and Sally Mood. And that's one of our main kiosks there. We also have one on the Georgia Southern Armstrong campus at the Student Union building. So right in the main Armstrong campus, the Student Union building, there's a kiosk there as well. And anybody 16 years and up can utilize a kiosk. For people 15 and under, we do ask that they be accompanied with an adult. But anybody 16 and up is allowed to go and get tests available from the kiosk. They can literally walk to their car, perform the test right there, walk back, deposit their test, and they'll have the results typically within about 48 hours.
So are you still getting a lot of walk-ins for COVID testing?
So the numbers did go down a good bit. We had a drive-in kind of COVID testing site in West Chatham for a while in Pula area, but that site did close on June 30th. So most of our testing we're doing now, we're doing it because there's not a need for it necessarily every day. We're doing it Monday, Wednesdays, and Fridays at our main health department site on Eisenhower.
So when do you think the combined COVID and flu vaccine will be available, and what advice do you have with that?
That's a good question, because I think a lot of people have anticipated there is a strong chance that this is, again, the good news is that it's not going to be like before, where it seemed like every few months they were asking us to get another COVID vaccine. It does seem like it's pretty simplified. Like I said, probably one bivalent booster shot, maybe yearly, maybe seasonally, like the flu. So a lot of people are saying, well, gosh, if you can combine that shot, I don't want to get multiple shots. Can I just get my flu and together? I'm sure that probably will happen. The downside is that it probably won't happen for this year, based on what I'm hearing. Just time frame wise, because flu season is actually getting pretty close if you think about it. It's way over half the year is over. It's mid-July now, so probably it won't be for this season. But I'm guessing that if COVID is in the form it is right now and still around in 2024, then it'll probably be a combined shot by then.
So I know when I had my vaccine, I did have some side effects. So if I got the flu and COVID together, would I have double the side effects?
So, I've heard people say that about like having vaccine side effects, and I've never really seen a great correlation with the number of vaccines and reactions, because every vaccine is different as far as how it interacts with people. So, I've seen people get one single vaccine and feel crummy and say they feel like they feel awful and don't even want to go to work. And I've also seen people get like they're due for several vaccines to get 3 or 4 at a time and feel fine. So I've never really seen a great, like in personal practice, but also just in what I've read, I've never seen a real correlation between the more number you get, the worse you'll feel. So I think it's just really luck of the draw. It depends on everybody. I know people who we get fever sometimes after vaccination. That's never happened to me in my 46 years on the planet. Most of out of all my kids, I have 3 kids, and who knows how many vaccinations total. And only one of them, I remember my oldest daughter one time had a fever after one of her shots, and that was it. So it's so dependent. A lot of people, when the COVID vaccine came out, people were like, "Oh my gosh, like the first one's not bad, but the second shot's the one that does it for you." That's what everybody was telling me.
I heard that too.
My first one and had a terrible headache, like for the entire day, and I never get headaches. And then the second one, I felt great after I got it. I remember that day after my second shot, I went out and ran 6 miles. Like I felt fine. So everybody's body's different. You never know. The same way some people can eat certain foods and have upset stomach and other people don't. It's just very dependent. I always discourage people from listening too much about what other people's personal experience is.
Dr. Reddick, could you tell us a little bit about the upcoming monovalent vaccine, because people are fatigued, and maybe if we let them know in advance that another one is coming and why it's important to take it, maybe they'll be more open to it.
Sure. So it's not as kind of crazy and scary as it sounds, right? So what it is that the monovalent, kind of mono meaning one, right? So there was kind of one strain of COVID that was out back in, 2020 to 2021. And so that we call that the monovalent vaccine. But as we know, the virus, like every other virus, mutates, right? So we had different strains. We had a Delta strain and the Omicron strain. And so the vaccination changed where it included these other strains. So then it had the old strains and the new strains. So there were 2 different strains covered by the vaccine. So that's why it's called bivalent, bi meaning 2, right? Well, the old strains are so long gone that they're just not around anymore. It's only these newer strains that are around. So there's no need to continue manufacturing vaccines of the old strain. So that bivalent is unnecessary because one of the two strains in there are just worthless. Like they don't do anything anymore. They're not even around anymore. And so they're kind of starting to produce just another monovalent vaccine, which just has the newer strains in it. Mm-hmm. So that's kind of why so a lot of them may get confused because they may say, wait, they told me that monovalent isn't any good anymore. I got to get the bivalent. And now somebody's trying to offer another monovalent. It's not the same old monovalent that we used to use. It's the newer one. And so if somebody comes out and hears you have to get this monovalent vaccine, again, there's not a clear recommendation right now saying that if you have the bivalent vaccine, you're up to date, that you have to still get this monovalent vaccine. But if you are getting any boosters kind of in the near future on, you're probably going to hear about it being this new monovalent one.
Is it based on the Moderna science or the Pfizer science?
It's all the same science. Yeah. So
one wasn't different. All right.
Yeah. Here's the good news. The old monovalent vaccine was taken off the market essentially. So it has not been available since, I don't remember the exact date, but it was some date in March. It was some date in May. It was like right before, either right after the end of the public health emergency. And the public health emergency ended on May 11th. So it was either a week before or a week after. The old monovalent is no longer available. So you don't even have to think about that. Like whatever vaccine is available is the new updated one.
Because I originally got the Johnson & Johnson because it was just the one shot. And then there was the Pfizer and Moderna. So now you're saying it's all just going to be one.
Yeah. So if the only vaccine you've gotten is the Johnson & Johnson, you're like everybody else. Everybody has to have gotten at least one dose of that bivalent booster. So even if
I got a Moderna afterwards too.
Yeah. So if you got the Moderna bivalent, then you're good to go.
Okay.
Yeah, again, unless over age 65 or immune compromised state, those are people that the doctor may recommend a second dose. But outside of that, that's it.
Could I go back to the cost? Because my understanding is that there's still a lot of places still have stockpiles, probably like the health department, of the bivalent vaccine that was free. But there are and if you have Medicaid and Medicare, probably that it would still be free to you. So is your understanding that we're still running through that big free supply, and that probably at the end of the year it might or closer to the end of the year we may have to pay?
So I don't think it'll be the end of the year. So I actually jotted this down because people always ask me about that. And I wish I could remember the exact name, but there's a specific program that is there to cover costs for anybody who has unreimbursed costs and is able to pay. And that stockpile should last us at the rate we have and based on the population and the supplies we have through the end of 2024. Oh, so we actually should be okay. We should be okay. So it shouldn't be an issue for that. That's a great question though. Again, there are some changes in how we do it. A lot of this was given to us as far as federal stockpiles for free. So there's going to be some cost to the health departments, possibly for the new monovalent, the same way we do with other vaccinations as well. But the good news is for the typical public, for anybody whose insurance is not covering it, it comes, those things will be covered. So people can still shouldn't have to worry about costs if they need to. Again, that happens frequently where people will go to their private doctor and they'll get all the care they need. If there's certain vaccinations that aren't covered, they'll say, you should probably go to the health department to get that one done. It'll be a lot more affordable for you to do it that way.
So nobody has to worry about getting in line and getting the shot and then getting embarrassed. It's like, oh, you need to pay such and such.
Exactly. Yeah. And sometimes it kind of confuses people because we'll say things like with the kiosk that if you have insurance, please bring your insurance card. And the reason for that is because some insurances will cover testing or cover a certain number of tests per year per month. And so if you're happen to be fortunate to have an insurance that does that, we're like, please bring your insurance card so that we can bill your insurance and get it covered that way. And it's not because we're out trying to get rich or anything like that. The reason why is because the more we kind of, if there's service that your insurance pays for, take advantage of it. And by doing that, if it helps us save money by billing insurance, we can use that money to help other people as well. We're not using it to line our pockets. Everybody who works for us is salary. We don't get extra money by seeing extra patients or giving extra vaccines. When we have additional money that comes in from insurance companies or things like that, then we're able to do things like this past weekend where Healthy Savannah was out there with us out at the Community Resources Fair this past weekend. We can do things like that with that. So when we ask you to bring insurance cards, not because we're saying if you don't have insurance, you're going to have to pay. We're saying let us try to bill your insurance in case they happen to cover it. So don't let that be a thing that scares you off for people who are thinking about getting tests or getting vaccinations if we ask for insurance information.
So I'd like to ask both of you this next question. What would you tell somebody that is on the fence about getting a shot for the first time, getting a vaccine for the first time. Give me your best marketing pitch of what it would take to make them or suggest that they get the vaccine.
Doc, you go first.
Okay, so I get this question a lot. I graduated med school in 2002, so in 21 years, I've gotten this question probably on a weekly basis, just about other vaccines. I did pediatric care. I'm a family physician, but about a third of my patient panel were kids throughout most of my career. So on a weekly basis, I got questions from parents concerned about vaccines. So the thing that happens a lot of times, there's a back and forth conversation. It's not just me trying to convince them. I'll just ask them, what questions do you have or what concerns do you have? That's how I always lead, because I don't want to start rambling about something they don't want to hear about. So I just ask them, do you have any concerns or questions about me, or what are your issues that you're worried about? And from there, I usually can kind of ferret out what's going on. The question I get most often is, did I get the shot, and did I give my kids the shot? That's what people mostly want to know. And so if somebody says, like, I'm just really nervous, what can you say that'll put my mind at ease? I'll tell them, I've been studying this literally since, I guess, 1998 when I started medical school. And because I, had 3 kids, and I wanted to be sure that the things I was reading that I'm giving my kids is safe. So I'm studying this for my patients, for my own personal family, and for myself, because I get vaccines as well. So I've studied this extensively. Being involved with Health Equity Council for COVID was important to me as well. A lot of people who come and talk to me talk about concerns about racism in medicine, like we talked about Tuskegee earlier today. So a lot of people tell me, like, as a Black man, why do you support vaccines? And aren't you worried about this or that? And so I tell them about my background in public health. My grad school work was actually in health disparities. So I actually focused on racial and ethnic health disparities and how racial and ethnic minorities are mistreated in healthcare systems. So that's literally my career, my academic focus, is being sure that people from my community are not mistreated by the healthcare system. So I'm literally looking out for people's best interests in my community, and myself, my family, my kids as well. So that's usually what I tell people. And that usually, and if they have questions about things they've read, sometimes they'll share comments with me or ask about mercury in vaccines or things they've heard about, or does it cause autism or things like that. So, and I just share the data with them. And again, some people, not everybody gets vaccinated, but most people, after we have discussions, they usually go follow through with it.
Excellent. Oh, yeah, that is, I love the fact that you tell them that you have had the vaccine and your family, and that you've studied it for years and years. So that's huge. That kind of testimony it matters, and people listen to that. Yeah.
Yeah. One page was hilarious that I saw kind of mid-COVID pandemic. Kind of walked in and was on the phone, and I could hear them arguing with the family member who was clearly trying to convince them to get the COVID vaccine. And they were like, I ain't getting that shot. And so, and they were like, I bet you Dr. Reddick ain't get that shot. You didn't get that shot, did you, Dr. Reddick? I was like, yeah, I did. They were like, what? And they were stunned that I got the shot. And they were like, I'm going to call you back later. And we had a discussion. They ended up getting the vaccine. So a lot of people were just really, a lot of times they just assume that people are hearing the same things they're hearing. And they just want to hear a trusted voice or somebody that they believe in what they're saying, and say, like, explain to me why I should get this shot. So
that's huge. Michelle, how about you?
Well, I am a former health journalist, so I take the same tack that Dr. Reddick would. I'd ask questions, and because I'm not going to strong arm anybody into getting a shot, but I would want to know some of their reasoning and some of their questions, and I would tell them one. Yeah, before the vaccine came out, I had questions too. I said, I'm going to wait and see. I'm going to wait and learn more about this before I, just jump out and get a shot. There is, and I would reassure them and say, there's no reason for you to just automatically trust it, but there is good reason to go out and get solid scientific information about it, and not to get information or I guess misinformation from social media and others. And I mean, I'm not demonizing social media, but when there is no scientific basis for the information, I would probably reject it. So,
very good.
And real quick, I found it. I was kind of trying to sneak down and peek at it. So it's the Safe Patient Care in Public Health Settings policy that they're using to make sure that people have coverage kind of after the end of the public health emergency. And again, the notification I had said that patients should be covered during the time of the emergency, up at least until from fall of 2023 until December of 2024.
Excellent.
Yeah.
Excellent.
Mm-hmm.
So as we start to wrap up, let's just review the big takeaways of what we really want our Savannah community to know about the status of COVID-19.
So I think my big take-home point is that COVID is still around, just like flu is still around. You know, the coronavirus, which is what COVID is, has been around forever. It was when I was in medical school, when I started 25 years ago, they told us that the coronavirus is the second most common cause of the common cold. It mutated into a form that we had never seen before that was just killing people like on a level we hadn't seen in the United States in 100 years. And the good news is that it's kind of mutated into a different form that's not quite as deadly, but that can still kill people. The same way flu can kill people. Flu every year kills tens of thousands of people. And just because flu hasn't caused a global pandemic doesn't mean we say, it's no big deal if I catch the flu. It's not whatever, who cares? It's just the flu. Again, tens of thousands of people have died from the flu every year that I've been alive. So that's still a lot of people. And for people who like really value life and care about their neighbors and people around them, then that should be a big deal. We should make sure we do everything we can to make sure we continue to mitigate the spread. Continue to stay away from people if you're sick. If you've got symptoms or waiting on a test, wear a mask. If you test positive, try to stay away from people for at least 5 days. And if you're not vaccinated, we've had enough data right now. It's time to get vaccinated if you haven't at this point. For people who don't want to at least do the other things I mentioned, and for people who haven't gotten their bivalent boosters that don't mind getting vaccinated, just get at least one dose of that bivalent booster, or unless you're higher risk, and get 2 doses, and then you're good to go. And then the last point for people who have mistrust of vaccines, I heard somebody say this the other day, and I thought it was pretty profound, is that during the pandemic, hospitals were full of people that were dying from COVID. And for people that are worried about vaccination safety, hospitals were not full of people dying from vaccinations. They were full of people dying from COVID. COVID is way, way more dangerous than a vaccine could ever be. If you eat peanuts or drive down the road, then you do activities that are way more dangerous than getting a vaccine.
Mm-hmm. Wow, it's hard to follow that, but I'm going to try. Healthy Savannah works to raise awareness and access to the COVID vaccine. And in the bigger picture, we are working toward, health equity. Just like Dr. Reddick. And, the idea is that, Black and brown communities suffer disproportionately during COVID. We were hit hardest. We often had the kinds of jobs that were considered essential, and therefore we were exposed to more folks. Yeah. So we hope to, close the gap with information and access. And I was just talking with Dr. Reddick. We grew up in the same church, and and it's so important. Some of the churches in our community have really gone, above and beyond to address the issue. And when we help those churches put on, information sessions and health fairs and festivals, again, just so that those communities can get that information and to spread it out.
So, and if folks want to find out more information, how can they, who they call, what's the website they should go visit?
Okay. So,
go ahead.
I'm sorry, I think I got a delay for a second. I'm sorry if I'm chopped up.
Dr. Reddick, she was asking for a website or an 800 number, wherever. Oh, sure. Yeah, where people can get more information.
Yeah, so Georgia Department of Public Health or our local coastalhealthdistrict.org, any of our, the DPH or the local coastal DPH websites are all available. I think COVID, if I'm not mistaken, is the very first bullet point on the left-hand side when you go to the website, so it should be pretty obvious. And once you go to either our local or our state DPH office and click on COVID, you'll see different links. There's a link for testing, there's a link for vaccinations, there's a link for just information as well. So those are there. And then, of course, our local health department, again, located at 1395 Eisenhower Drive is there. And again, don't worry about cost and that sort of thing. Like I said, I keep forgetting the name of it, the Bridge Access Program for COVID vaccines and treatments is in place from fall of this year through December of 2024. So you can receive testing, you can receive, vaccinations and also therapeutics as well if you're unfortunate and get infected with COVID. So we're there, and cost should not be a barrier for you.
Awesome. Dr. Reddick, thank you so much for, keeping your eye out and helping our community raise awareness about how important it is to get this vaccine. And Nichelle, thank you for all your work with the REACH grant and the COVID flu and Healthy Savannah, and reaching out to the communities and making sure they have the right, correct information to keep our community healthy. I mean, great work. So, yep, I want to thank you all for being on the water cooler. And until next time, be safe out there. Go out and get your COVID vaccine, and we'll see you all on the next water cooler.
Thank you so much.